There are several different causes of lower back pain in runners. It's a complex area. It can be split out into muscular, facet joint, disc, sacroiliac joint and nerve. The best way to get a full diagnosis is to have an assessment with a chartered physiotherapist. The simpler way of working out yourself at home is around if you have a general ache across the low back or maybe just to one side. That's going to be a mechanical type pain and is less to worry about. However, if you've got symptoms going down into your backside, down a leg, certainly down both legs, burning pins and needles, nerve type pain into those areas, and it's persisting for a number of weeks, that's the time to get it assessed properly. Muscular back pain is very much across the back itself. Sometimes just one side, sometimes it's across the whole of the spine. It's a dull ache. It can be a bit sharp on some movements. It's stiffer after you've been sat for a period of time. And you can usually go, okay, I moved that plant pot in the garden, I put some suitcases in the back of the car. I know what I did something to it. Facet joints are the small joints at either side of the spine itself. And you can think of those as injured when like you sprain an ankle, you've done something to it, you've lifted something, you've bent awkwardly. Often it's a range of movement thing where you've reached into a cupboard or off of a step ladder. And it's a strain. It can be quite sharp initially, first few days, and then it settles down usually over about a week to 10 days. A disc issue is caused by a bulging of the spinal disc and it puts pressure on the nerve. It sends pain down into the low back, but it also goes into your backside, potentially into the upper thigh, sometimes far down into the calf and into the foot. You have burning, you have pins and needles, you can have numbness down that one leg, sometimes both legs. It's caused by usually a lifting. You know that you've done something, you wake up the next day with a lot of pain. It doesn't necessarily have to be immediate. And it can linger for 4 to 6 weeks. It's a much more persistent problem. SIJ or sacroiliac joint is the pelvis. It's the point of the joint between the sacrum and the ilium. It's lower down in the back. It's very much at your waistline, commonly off to one side, and you'll have not often much pain in the actual spot itself, but you'll have tightness into your backside, into your bum, top of your hamstring, and it feels like the leg just doesn't really want to move, doesn't want to come through. Runners talk about it as the leg feels like it's a passenger and they have no power in it. An SIJ injury can be caused often by downhill running. So if you're a runner that does those sort of sessions, a lot of hill sessions, it's caused by the impact or the lack of impact control as you're coming down a hill, potentially without the pelvis being in control position. And it's not necessarily something that causes you pain immediately, but generally leads on to stiffnesses and tightnesses down through the chain over the next few days. Main symptoms of nerves can be anything from pain in the back, pain in the backside, pain and stiffness and tightness down into the hamstrings and into the calf. It can also cause burning and pins and needles and more nerve type symptoms. All of the issues we've discussed, like sacroiliac joint, disc and facet, can cause nerve related pain. It can be to do with the nerve being pinched in the spine itself, the muscles being very tight around it, particularly say through the glutes, and an irritation of the way in which the nerve is able to move and to slide and glide through the body. The essence of treating any of these injuries is about treating the cause. Now, if you've got a muscular strain and it's just to do with the muscle in the back, it can be helped by simple stretches, massage, mobilization, bit of heat, and they're the ones that settle down quite quickly. If you've got a facet joint strain, which will last a wee bit longer, and it's like a strain of the joint, much like an ankle sprain, then you need to give it a few days worth of rest to allow things to heal and to settle down. And it can then equally be helped by stretching and easy mobilization. Nerve pain that's caused by the disc, you have to resolve the disc issue. Now that can be a small bulge that can last only a few days, or get a thinning of the disc can last a bit longer. A big prolapse can take several weeks to settle down, so it depends on the level of symptom there, and those are the ones that you probably need to get some medical assistance with and some advice from, say, a chartered physiotherapist. Sacroiliac joints are very common, as we discussed, in runners, particularly if you've been doing a fair bit of downhill running in your sessions recently. Those can be worked on with stretching and mobilizing through the hip, but again, you probably need to get some assistance by a physio to get that joint moving if it's become recalcitrantly stuck and will not get moving on its own. There are some generic exercises which can be very useful for all back conditions. It's a complex area. Sacroiliac joints are very different to facet joints, so getting the right exercises from a medical professional, chartered physiotherapist, is actually very important to get exactly the right ones. However, there are some generic principles that you can apply to all back pain. That's getting the right flexibility in the spine, getting the right strength in and around the spine, and that's not just the back muscles but your core muscles and also your gluteal muscles, and getting the lengths and strengths in your legs working well. There are some exercises like dead bugs, side planks, glute bridges and any abdominal core work which can be very useful across the board. We will all suffer from low back pain at some point in our life. It's usually about 90% of us get it. Stuff that can persist for more than 6 weeks, you really do need to get it assessed. And certainly when you've got sciatica and pain going down the leg on a persistent basis, you need to get that assessed properly. The time to be very concerned about your back pain symptoms is when you have bilateral symptoms down both legs, burning pins and needles, you have bladder and bowel, control issues, your gait is starting to become unsteady and you're falling over with it. That's a medical emergency. You need to take yourself to A&E immediately. The severe symptoms are very rare, but just be aware of them.